Should we start now?
Good morning, everybody. Hello. Welcome to this webinar on the AIHW's Indigenous Mental Health and Suicide Prevention Clearinghouse. I'm Ted Wilkes, a Noongar man from Western Australia and Indigenous advisor to the Australian Institute of Health and Welfare. Before we begin, have we started?
Yeah, you're saying live, so I presume we have.
Yep, we've started, Ted. Keep going.
Yeah.
I would like to. Yes, we have started. Sorry, everyone.
Sorry, everyone. Technology glitches.
Yes. Well, I got to the part where yes, so I would like to acknowledge acknowledgement of country and a welcome to country. I'm sitting in Perth on my home land on the Noongar Budja, and I guess the first way for me to do that is to ensure that I do it from my heart. So let me say, Puai Ngana Daja, Puai Wago Mial Jinning and Nicha, Wachak Budja. So I welcome you through this medium to my land for me to be able to talk to you, but I also acknowledge elders past and present and those who are coming forward for the future, to say to them thank you for, I'm having a double hit here. I can hear myself talking back.
Oh, so there's some feedback. Hang on, I'll go get some help.
Very unsettling.
Whether our computer's too close.
So I'll try and continue while Pat's getting some help. So, as I said, I acknowledge that we are sitting around in different parts of Australia, maybe, but certainly I know there are a few of you, probably more in Canberra, colleagues of mine that I intend to catch up with and work with. So before Pat gets back, I would like to just reiterate that Aboriginal leaders like Pat and myself, we have a connection to many other Aboriginal people around Australia. And today, this is, I'm getting feedback. I'm hearing myself talk.
Something's wrong with recording it.
It's just an email flagging.
So, yeah, so the feedback I'm getting is a bit disconcerting for me, and I'm not able to continue to talk properly, people. So if the organisers can just fix that up for me, that'd be good. I'm going to ask Pat to get ready to come on now.
Yeah, no, but mine will probably have when I
Yep.
start.
So before, let's just continue. I have done an acknowledgement to country, and
Pat,
Yeah.
can I get, or Ted, can I get you to unmute? Ted, I've just muted you and hoping it will reset.
Ted, if you want to unmute yours.
okay, I've got it unmuted.
Because that was very disconcerting.
So I'll continue now. So I acknowledge all the elders around. So that's my microphone, isn't it? Yeah, my mic's on. Are we ready to go then?
Yeah, we might just try and continue, Ted, and might just hand over to Pat when you're ready, and I'll get Pat to unmute.
All right. So before I hand over to Pat, I'd like to give you some context about social and emotional well-being among Aboriginal and Torres Strait Islander people. So we need to go to slide 2. There we go. Okay. So for many Indigenous Australians, good mental health is indicated by feeling a sense of belonging, having strong cultural identity, maintaining positive interpersonal relationships, and feeling that life has purpose and value. The legacies of colonisation and the ongoing trauma experienced by Indigenous Australians, dispossession from land, forced removal of Indigenous children from families, and institutional racism also affect mental health and have enduring effects on social and emotional well-being. Suicide and self-harm behaviours arise from a complex web of personal, social and historical factors, but they can be prevented. An understanding of these factors and their impact on the social and emotional well-being of Aboriginal and Torres Strait Islander people is key to addressing issues related to mental health and suicide among our people. Here with me to talk about Indigenous mental health and suicide prevention clearinghouse is Professor Pat Dudgeon, who is the Director of the Centre of Best Practice in Aboriginal and Torres Strait Islander suicide prevention at the University of Western Australia. Professor Pat Dudgeon was born and raised in Darwin and is descendant from the Bardi people in the Kimberley. She served as a Commissioner of the Australian National Mental Health Commission and has published extensively on Indigenous mental health, social and emotional well-being, and suicide prevention. She is a Fellow in the Australian Psychological Society and has served on many boards and councils and is currently a board member of the Indigenous Australian Psychologists Association and is currently and of the AIHW, the Proud Spirit Australia. Pat is also the chair of the Indigenous Mental Health and Suicide Prevention Clearinghouse Steering Committee. Welcome, Pat. Pat, can you firstly tell me about the background and purpose of the Clearinghouse?
Well, first, thank you, Ted, and thank you for your acknowledgement of country and welcoming us all. I think that's really important. I'm not having any feedback, I don't think, knock on wood. But thank you, Ted, and thank you, the Australian Institute of Health and Welfare. This is an important, the Institute is an important organisation, but the Clearinghouse is very important as well. So the Clearinghouse was established under the 5th Mental Health and Suicide Prevention Plan. And they identified the need for better evidence to support the development of culturally safe models of service delivery. In particular, and if you see on the slide there, in particular, priority 4 of the 5th plan is focused on improving Aboriginal and Torres Strait Islander mental health and suicide prevention. Action 13 commits governments to strengthening the evidence base needed to improve mental health services and outcomes for Aboriginal Torres Strait Islander peoples. The Indigenous Mental Health and Suicide Prevention Clearinghouse is funded by the Commonwealth Department of Health to support this evidence base. Next slide. This Clearinghouse was developed in consultation with experts in Indigenous mental health and suicide prevention, service providers and policy makers. The work of the Clearinghouse is overseen by a steering committee which has representation from researchers, service providers, advocates and government. And it advises all aspects of the Clearinghouse work, including its design, development, of content and communications, and I won't go through all the names on that list. You'll see that it's most, very relevant people, and in particular the Centre for Best Practice in Aboriginal Torres Strait Islander Suicide Prevention. I actually chair that committee, and AIHW Proud Spirit Australia, a new organisation that has formed and is the peak body representing Indigenous mental health, suicide prevention and social emotional wellbeing. So, and as importantly, we've got the National Aboriginal Community Controlled Health Organisation, or NACCHO, as a part of that. So it's got excellent representation and all the relevant bodies are a part of this. But we'll go to the next slide. The Clearinghouse website was launched last year in July with the release of 6 publications. So we kicked off with that, and that happened in March this year. The Clearinghouse was updated with 5 additional publications. Our purpose and objectives are to improve the evidence base about what works and does not work relating to Indigenous mental health and suicide prevention, including identifying gaps in the evidence. So that's an important part as well. Our other objectives include improving the access to key information by pulling together the emerging research, evaluation, program and policy initiatives and the evidence from these initiatives. Our final objective is to encourage collaboration between researchers and reduce the chance of duplication in research activity. Therefore, we promote a more coordinated research and evaluation effort, because that is one of the issues, is that people tend to work in silos. So the Clearinghouse can be a vehicle to bring people together and encourage coordination. But over to you, Ted.
Thank you, Pat. Pat, the Clearinghouse website has beautiful artwork. Can you tell us about the artwork and the artist, please?
Okay, next, we'll go to our next slide because this is important. If you ever see an Aboriginal artwork on a policy document, always remember, usually there is a story behind it, where art is not just for the aesthetics. They are also beautiful and pleasing to the eye, but our Indigenous artwork has meaning. So with the Clearinghouse website and publications, you'll notice on the artwork on the side of the banner of the slides today that this is the Clearinghouse artwork, and it's called The Journey Towards Healing. The slide that is up now gives a description of what each of the elements in the artwork represent. The blue artwork on the side of the text are the icons used for some of the topic pages and resources in the website. Now, this artwork was designed by local Indigenous artist, Linda Huddleston, from the Nungini group. That's her language group, and Linda has connections to the Nunga language group in the Roper River region of East Arnhem Land through her father's people, and her paintings are based on the custodial country and stories associated with it. I understand that she's been exhibiting her artwork in venues in Darwin, Canberra, and the local markets in Canberra for the past 10 years. So we were really grateful and proud that the Institute of Health and Welfare commissioned this piece from Linda, and a very important piece that it is. But back to you now, Ted. And next slide. Yeah, back to Ted and next slide.
So thanks, Pat. Now, can you tell us what information is available on the Clearinghouse website?
Okay, this is the main bit of our presentation. If we can change slides. We are having some technological difficulties. I'm going to continue talking. The slide will change accordingly. Currently, this Clearinghouse website has 3 major sources of information. There's topic pages, a research and evaluation register, and publications. So the topic page, in the topic pages, there are 9 topics with contextual information, relevant statistics, and downloadable data. On the research and evaluation register, there is a catalogue of research and evaluation projects that have reviewed programs specific to improving the mental health or preventing suicide amongst our people, amongst Indigenous Australians. In the publications area, there are specifically commissioned articles that provide contextual information, a summary of key policies and frameworks, a description of programs and program evaluation, gaps and the limitations in program application and evidence. So we'll go to the next slide now. I'm going too fast for the slides. No, okay, there's also a resources page that contains information on relevant data sources, data tables, and recommended resources, as well as a glossary of terms. So do have a look at this, it's important. And it's drawing, we're drawing upon many different areas, reputable areas, to pull together all this information. If we can go to slide 9, the slides are a bit delayed.
Your laptop.
I don't know. Okay, before we discuss the main parts of the website, I want to note that the data sources for the data presented on the topic pages, you can see some of these on the slide. The data sources used for the website are mainly the Australian Institute of Health and Welfare and Australian Bureau of Statistics data collections. There are 11 Institute of Health and Welfare data sources ranging from hospital data and collections, the Australian Burden of Disease database, Indigenous specific collections like Online Services Report, and various other health and wellbeing collections. The ABS data collections include causes of death and the Aboriginal and Torres Strait Islander social surveys. Other data sources include NDIS, public data collection, and the Australian Early Development Census. So very reputable places. Next slide. Moving on to the topic pages, there are the nine topics on the Clearinghouse website were selected with consultation with the steering committee. So we have social and emotional wellbeing, which discusses Indigenous perspectives of health. Mental health is another topic area, and that explores contributions to good and poor mental health and the connection to mind and emotions. So if you just think back to the social emotional diagram that you saw earlier, that was developed by Indigenous people. That came from a whole history of development. But more recently, the Australian Indigenous psychologists put that diagram together to show that Indigenous social emotional wellbeing isn't just about mind and body, but it's a whole range of other important aspects, such as connection to your family, to your community, to your country, to your culture, to your spirit and spirituality. But around that is the social determinants and a history of colonisation. So we can't look at Indigenous health and well-being unless we take that into consideration. And the topic areas in the Clearinghouse do reflect this. So there is social emotional well-being, there's mental health, suicide prevention. So the suicide prevention topic area provides information on suicide rates and the unique risk factors for suicide for Indigenous Australians, including social and historical factors. Family and community, if I had a little pointer, I'd be pointing at it, but you can just direct your eyes accordingly, explains how Indigenous people's mental health can be supported by connection to family, community and kinship. Culture, country and spirituality provides descriptions of each of these areas and links them to social and emotional wellbeing. Physical health describes how the body, mind and spirit are all connected and shows how physical health can impact on mental health. Education and employment provides evidence that education and employment both supportive of physical and mental health, and it identifies that some of the barriers that Indigenous people may face in accessing suitable education and employment. And we know that, you know, there's a whole those databases that we spoke about, Indigenous education, employment is very poor, so we don't get access to the same opportunities that other Australians have, and that does impact on any person's mental health, but particularly for our people. And I'll be talking about that a little bit more in a bit more detail, because later on I'll just unpack some of the papers. But I'll move on. Housing and homelessness is another big issue for Aboriginal Torres Strait Islander people. There's rarely a gathering that we have, and you know, and when we talk about what the needs are, and it is there's always a lack of appropriate housing is always one of the topic areas. So that's it's good that that has become an important issue, and that is related again to our well-being. That particular topic area identifies that safe and stable and secure housing can support our social and emotional well-being, as can be as being on and caring for country. So that's another important one. Service provision explores the issues of access, cultural safety and self-determination relating to the provision of suicide prevention and postvention services and mental and physical health services. So that's about all the topic pages. Do have a look at them. Very important topics that we've highlighted because they are the big issues that need to be addressed if we're going to move towards supporting Aboriginal Torres Strait Islander people to have better social emotional wellbeing and better health overall. But we'll go to the next slide now and talk a little bit about something exciting, the Research and Evaluation Register. Okay, the Research and Evaluation Register is a catalogue that currently lists 52 projects, so very important. The register is updated with new submissions every 6 months. The research and evaluation projects are sourced from relevant Commonwealth, state and territory government departments and agencies, as well as universities and non-government organisations. So that's an important part of the Clearinghouse, and certainly will be ensuring that the Centre for Best Practice, for instance, and a big research project that we're involved in, where at UWA we also have the Transforming Indigenous Mental Health, sorry, I'll start again. At UWA we also have the Transforming Indigenous Mental Health and Wellbeing research project, which Ted is a part of, and that's an important project because there we're looking at, you know, how do we increase access to good services? What, you know, how do we make services culturally responsive? How do we work in with Aboriginal community controlled health services to assist them to identify what social emotional wellbeing needs their clients have and provide appropriate services. So there's a number of different projects, but certainly we draw upon the Research and Evaluation Register, and that information will also be going on the Centre's websites as well. So that's very important. And as I said earlier, you know, it is important that we've got some central body, well, that's what a clearinghouse is, that, you know, says this is happening across the nation, you know, this project, that initiative, because otherwise we start beavering away. And I see that particularly in research where everyone's doing research, and you don't want to all be clones in your research, definitely not. But if there's another project that's happening and being funded, it would be good to communicate with those projects. So it's good to know what different people are doing and like-minded topics or approaches, and to make connections. But having said that, as well, you know, there should never ever be one approach. We need a whole diversity, and that brings richness to the process. But we'll go on to slide 12, where we are. The information contained on the register are links to research and evaluation reports, status of programs and projects. So, you know, whether or not good rich detail, whether projects are currently underway or have been completed, and the organisations on who are conducting the research or evaluation, and funding bodies. So there's very good detail on there. And each of the projects are categorised under mental health, social emotional wellbeing, or suicide prevention. For example, the project Aboriginal and Torres Strait Islander family-led decision-making trial in Queensland aims to do multiple things, including promoting self-determination, participation and shared decision-making in different phases of child protection continuum. And this project is under the social and emotional wellbeing category. So next slide, we'll look at our publications now. We've got a number of articles that are authored by commissioned subject matter experts. There are currently 11 articles on the publication page, 6, as we mentioned earlier, 6 were released in July last year in 2021 with the launch, and there was an additional 5 released in March this year, 2022. Most of the articles provide the following: an overview of selected factors that influence mental health and suicide amongst Indigenous communities and the programs that are implemented to address these factors. They also contain contextual background, a summary of key policies and frameworks, a description of program and program evaluation, gaps and limitations in program application and evidence. And finally, they also contain a section identifying research and evaluations that have directly or indirectly impacted upon Indigenous mental health and suicide prevention, or other elements of wellbeing that are affected or affect mental health and suicide behaviour. Okay, the first set of articles released with the Clearinghouse launch explored the following 6 issues. 1, evidence deficit narratives in Indigenous suicide prevention. So that was important. In our own research, we'd come across that continually, you know, and it's an issue for Aboriginal Torres Strait Islander people. Something that has been taken up, and we're very conscious of, is that there are approaches that perceive Indigenous people, communities, and their issues in a very negative way, and it's not helpful. And read the paper. We do address that approach, and how a new approach doesn't shy away from the real problems, but it's how it's put, the context in which it's put, and whether or not there's Indigenous people involved. So a very important base paper. But there's also a publication that looks at connection between family, kinship, and social emotional wellbeing. There's a publication looking at food, body and mind. Another publication looking at improving Indigenous mental health outcomes with an Indigenous mental health workforce. So that is important for us too in our research and activities in Indigenous mental health and wellbeing, is to have an appropriate Indigenous workforce, but also have appropriately culturally responsive non-Indigenous workforce. So there's another important paper that looks at improving Indigenous mental health outcomes for Indigenous Australians in the criminal justice system, and also another publication about improving the mental health of Indigenous children and young people and child protection. So that was the first set of articles. The latest set of articles that were just released in March this year were connection to community, employment and Indigenous mental health, housing and homelessness, Indigenous self-governance for mental health and suicide prevention, and protective and risk factors amongst Indigenous Australians. So I'll just pass over to Ted, and what's happened is that we won't move the laptop. Ted's computer was having feedback issues, so he's now with me. We were in 2 separate rooms, so you'll hear his disembodied voice come across. Ted, over to you.
Thank you. Thank you, Patty. I'd like to let you just take a deep breath, because all of that information you gave there was very important, and it'll take people a little while to take all that in. But I know that we've all got our notes, and people will have those available. So your explanations are right on board, Bill. So thank you. That's the way we work. Yeah, I'm sitting in the ether here somewhere, and my feedback from before was just too unbearable for me to continue to have the discussion. So having gone through what you've gone through, Patty, could you tell us a little bit more about some of the more recent articles and why these topics are important to explore and what we might learn?
Thank you, Ted. So if we can go to the next slide, slide 14, and I'm going to start with an article that I co-authored with Abby Bray, Shoal Blueston, Tom Kelmer, Rob McPhee, Ian Ring and Rose Clark, and this was called Connection to Community. So we were particularly proud of this paper. This article is about the importance of connections to community as a source of resilience for Indigenous Australians. We know that research has shown that being connected to community builds a sense of cultural identity that can reduce suicide. While clinically based evidence is critical to targeted interventions with at-risk individuals, an understanding of the social determinants to suicide is increasingly important in developing prevention strategies, interventions, and initiatives that connect people to community support. And that, I think that for us, that was always an issue, but we see now with Christine Morgan's advice to the Prime Minister on suicide prevention that the impact of social determinants is also important in viewing mainstream suicide. So we need a very broad approach, and we always knew that. So community is one of the important parts of our social and emotional well-being. The concept of community is fundamental to identity and concepts of self in Indigenous Australian cultures. It defines our relationships, social roles, cultural norms and practices. It underpins our social and emotional well-being across the lifespan and across generations. So strengthening healthy connections to community have benefits of reclaiming. That's very much a part of our identity, and culture, and projects in mental health that increase self-esteem as a result of this protects people from suicide-related behaviour. Now, I know in that diagram you would have seen self in the centre and then all the different domains of social and emotional well-being. In the real world, as you probably suspected, it's not those. It's an artificial breakup of the different domains. They all overlap and intermesh. So community, families, for instance, make up our communities, and that's where we do practice culture as well. While important advances in government policy, resources and efforts have been directed at reducing suicide amongst our people, suicide rates in Australia are increasing, as well as in incidences of mental distress. So, we know that and I'm seeing personally a change happening. What we know is that Indigenous Australians are often burdened by trauma from colonisation and the ongoing transmission of trauma across generations as a result of the forced removal of children from their families and communities, the stolen generations. Recent advances in suicide research have argued for an analysis of community risk factors for suicide to develop interventions that can appropriately address relevant social forces or aspects of the environment that may contribute to suicide. So this article reviewed 7 programs that are trauma-informed, strength-based, Indigenous place-based healing practices, and they represented some of the most advanced bicultural healing practices in Australia. Many of the programs addressed ways of overcoming the social determinants that contribute to suicide and suicide-related behaviours. There's also a strong focus on overcoming mental health stigma, creating forms of culturally sensitive understandings of psychological stress and trauma, and using the expertise of people with lived experience. So, well, what do we know about what works? As I mentioned earlier, connection to community underpins interventions into Indigenous suicide prevention, which strengthens resilience and increases social and emotional well-being. The literature has shown that best practice programs and services should be concerned with self-determination and community governance, reconnection with community life, and restoration and community resilience. So it's not just a person in isolation, it's a person in their family and in their community. These all these different layers are important. We also had a look at what didn't work, and what doesn't work is interventions that only implement a clinical individualistic approach to suicide prevention, and that has limited success. Programs and strategies that do not have Indigenous governance over the design, implementation and evaluation have also not found to be been found to be effective, so they are ineffective. Approaches that are not Indigenous centred and place-based have numerous barriers to implementation and evaluation. Now, I'm going to briefly discuss the other articles released in March this year. Just quickly, if we can go to slide 15, employment and Indigenous mental health. Now, this article was authored by Boyd Hunter, Jonathan Dinku, Christian Eva, Francis Markham and Mindy Murray. So they had a look. This is a very good article. They looked at employment and financial security as the key drivers of better mental health outcomes for Indigenous Australians. They also looked, they saw that adverse employment outcomes and financial insecurity are very strongly associated with mental health issues. Employed Indigenous Australians are about half as likely to have high or very high levels of mental health distress compared to those who are unemployed. So social and economic conditions facing families are some of the big major constraints that limit effective treatment of health conditions, including mental health and suicide. While employment on its own is not sufficient to ensure mental health, good mental health, it can provide essential support by reducing financial hardship and the resulting family and household stress. Labour market and economic policy can be effective in improving Indigenous labour market outcomes and indirectly enhance our mental health. And that is so for mainstream as well. Everyone wants to have a meaningful job and to not be having financial hardship. So this article reviewed a total of 18 programs that involve the development of Indigenous skills and employment, focusing on ways to significantly focus to improve mental health outcomes in an employment context. The programs are customised to Aboriginal community needs and provide active engagement in customary Indigenous and cultural practices. All the studies reviewed indicate that poorer psychological health, there was poorer psychological health in the unemployed rather than the employed. And the article, the big messages from that article was that in Indigenous mental health outcomes are improved through meaningful employment and work that facilitate Indigenous agency and economic self-determination. Securing employment across the labour market is likely to be important for mental health. These working conditions should enable us to have control over our working environment, security and tenure, and an absence of discrimination. Economic policy has had a substantial impact on mental health outcomes and suicide prevention for Indigenous and non-Indigenous people. And improving the economic situation of our people, Indigenous people, will improve our mental health and suicide outcomes. So very important paper and sometimes overlooked, I'd say. So just moving on, I'll go to Indigenous mental health, housing and homelessness. This article was authored by Allen and Clark Consulting, and so this is an important one. As I said earlier, whenever we have a gathering, housing comes up, or the lack of housing is an issue that we need to address. So what do we know about mental health, housing and homelessness? That there's unreliable, poor quality housing and homelessness, and this country contributes to and perpetuates health inequities between Indigenous people and non-Indigenous people. Housing conditions such as affordability, availability, quality and overcrowding remain a big issue for many Indigenous communities who also experience high rates of homelessness. So the relationship between housing and mental health is bi-directional. A person's mental health can negatively be affected by the lack of a safe, affordable, good quality housing, and the existence of mental illness can also affect the individual's access to suitable housing. While there's a strong association between homelessness and mental health, there's few published studies that have assessed the impact of housing and homelessness on suicide. So this particular article on housing and homelessness reviewed 12 programs and evaluations and found that programs designed to provide strength-based, trauma-informed, recovery-oriented and culturally responsive holistic care management are more effective, which is not surprising. People tend to get the best health and housing outcomes when they receive a wraparound service, and the most effective are delivered by a client-centred collaborative team. And again, you know, housing is one of the social determinants in a social emotional wellbeing approach, and needs to be part of all the housing, employment, education. They're all important considerations. But existing policy approaches and programs aim to improve affordability and availability of quality housing for Indigenous people. So they are there, but they have varying degrees of focus on mental health outcomes and suicide prevention. Our next paper that I'd like to go into some detail about is Indigenous self-governance for mental health and suicide prevention. Now that's a big issue, and the whole issue that's become a new concept or word that we use. But Indigenous governance is about the self-determination, and we know from my history in mental health and suicide prevention, I was absolutely delighted to see the consumer movement come about, and then the lived experience movement come from that, where at the table you have consumers of mental health services, and now those with a lived experience of mental health issues or suicide prevention come to the table and be part of making decisions at every single level on policy and programs and so on. So at the time when the consumer movement started, they had this saying, "Nothing about us without us." And I thought, that's our saying, that's an Indigenous saying, there shouldn't be any policies about Indigenous people without their proper involvement. And so this again, this message is brought home by a paper whose authors include Kimberly Groves, Mark Moran and Josephine Bourne. And they focus on how before the 1970s, suicide was very rare. Now it's ramped up in Indigenous communities. Now it's the second leading cause of death for Indigenous males and the seventh leading cause of death for Indigenous females. So, overall we need to find different ways to prevent, improve mental health and suicide prevention, and self-governance is an important concept, and that needs to be put in action. And they, like us, drew heavily on Michael Chandler's work in First Nations suicide prevention, and found that where there was no or little rates of suicide, there were high rates of cultural reclamation and self-determination, so people were in charge of their own communities. And that message echoes through everything and everyone. This is, you know, an imperative that needs to happen for Indigenous people, but any marginalised and disempowered person or group needs to be in charge of their own business and supported to do that. So the article reviewed 12 program evaluations and found that Indigenous organisations contribute to mental health and suicide prevention in the following ways that were associated with self-governance, and they improved. They were about providing improved access to services and continuity of care within holistic mental health and suicide prevention models. That they were conceptualising and applying culturally appropriate models of wellbeing. That they were using cultural knowledge and principles in culturally responsive and trauma-informed healing. They were promoting personal and community empowerment for Indigenous people, and that they were driving action on the social determinants of health through advocacy and enabling connectivity within complex government systems. So the final one that I'm going to talk about is risk and protective factors amongst Indigenous Australians, and I hope I'm doing all these papers justice, and or at the very least I'm increasing everyone's interest, and you'll now go to the Clearinghouse, download the paper and read it. But the final paper that I'd like to just focus a little bit of attention is the protective and risk factors amongst for suicide amongst Indigenous people. So this article was authored by the Institute itself, and it's a literature review of risk and protective factors. So we know that suicide is influenced by a combination of factors that overlap and interact to affect a person's social and emotional well-being, and these include factors such as historical issues or the history, and environmental and societal circumstances, mental health, developmental experiences, socio-economic status, education and availability and accessibility of healthcare. So the relationship between protective and risk factors of suicide amongst Indigenous people is key to the development of appropriate policies and suicide prevention programs. This article identifies 17 key protective and risk factors that may contribute to suicide amongst Indigenous people, and they include things like demographic factors, you know, gender, age, location of residence, variable factors such as secure housing, alcohol and drug use, incarceration and employment, and factors specific to Indigenous Australians such as cultural continuity, spirituality, language and cultural understandings of well-being. The article notes the importance of using available data to explore the intersectional relationships between risk and protective factors that contribute to suicide amongst Indigenous Australians. Sorry, I've got a little cough. There are multiple data sources that track protective and risk factors to suicide, and using data to understand why suicide prevalence varies from location and out of time supports the ability for governments and communities to work together to implement evidence-based policies, interventions and suicide prevention programs. Thank you, Ted.
You're doing well.
Okay, my last bit, and then I'm going to hand over to Ted. Sorry, that's taken that's a long time, so I hope it's been interesting. I found it interesting. But lastly, I want to mention that a key focus of the Clearinghouse Steering Committee is how to communicate the findings of these articles to communities and health services. And to this end, the Steering Committee, with the assistance of the Indigenous Mental Health and Suicide Prevention Unit, are looking into and developing and testing plain English papers that summarise the key issues and findings of the articles. So the articles are important. They serve. There's a number of different audiences, but we also want the Indigenous community to utilise all this important information as well. So that's being currently considered by various steering committee members and their networks about how this is most useful and effective for all our different stakeholders. So the Clearinghouse in itself is very important and timely, but we need to be also promoting it in Aboriginal communities. But that ends my overview of the Clearinghouse. I'll now hand back to Ted.
Okay, thank you, Patty.
And have a lolly.
And you can now rest and have a little drink of water and have a lolly, yeah.
Have a throat cough lolly.
That was pretty full on, and that information. I'm not sure if people can see me, but anyway, that information is so important for us. And as our Indigenous brothers and sisters and others who have seen the development of our reaction to our social poverty and our poverty in Australia over the last 2 generations, I would imagine, you will see that I think we're closing in on some very practical interventions. The issue for us about these practical interventions is to make sure that we get good support from our non-Aboriginal brothers and sisters who work in this field, and we have the power to lobby those people who work in government for the resources to do this. Some of us have thought in the past that we would want an increase in the funding immediately, and people might know what we mean when we talk about a hump funding model. And this flat sort of model that we've got at the moment is, we don't believe, going to work too well. We need to put a lot of funding and resource into this effort. We've got the human resource involved with us now. We have some special connections with people who work in academia, and we have some special connections with people who work in government and public service. So, Patty, the task for us now is to harness all the talent we've got around us and all the information that we've got around us in this regard. So just to say to you, that was certainly an interesting exploration of the Clearinghouse and some of the content on Indigenous mental health and suicide prevention. So without further ado, I might now ask if we can go to questions from the audience.
Yeah.
Yeah.
So I've got one poking my face in.
Yeah, you can.
I'll swivel it back. Oh, that's how we'll do it. So if people can, if there's some burning questions, please ask them.
Okay, Pat, can you see the questions in the portal? There's a couple there for you.
Actually, there's something wrong. It's there's a wheel swirling around, so I've opened up the portal, but it's not happening. I might close it.
I can ask them for you.
Yes, that would be lovely.
What other topics might future Clearinghouse articles explore?
Okay, what other topics? Ted and I are going to answer this. I think, there's a whole bunch of different topics that we do need to look at. I'd be looking at racism. I think that's underplayed, and we know that there's been a bit of research done. We know, not a bit, there's been significant research done about the impacts of racism on wellbeing. So we need to start focusing on that, and not only the impacts of racism, but what we do to address it. So how do we turn that around? How do we protect people, particularly Indigenous Australians, but others, from people from other cultural groups as well? I'd like to see papers written about trauma, because that is an emerging issue, and for a lot of Aboriginal organisations and communities, they're insisting, and we're seeing that happening with the Aboriginal community-controlled health sector. They're now talking about we need to do things in a trauma-informed approach. So that's emerging, and rightly so too. I think, you know, when we were you know, years ago, we never talked about the stolen generations. We never talked about the traumatic, the processes that have happened as a part of that history. You know, the stolen generations, the forcible removal of children. You know, racism we talk about, and we're very much aware of racism. We see it, you know, now in football, when in the Adam Goods incident, which triggered a response. We're very much aware of Black Lives Matter, but and it's not denied like it used to be. I think those things were always there, but Australian society never shone a light on them. Now we're starting to identify them, and we're working together to say this is a problem. What do we do about it? So having a trauma-informed trauma and having trauma-informed approaches is very important. I think physical health, we need to go back there continually. While we focus on mental health and social emotional well-being, good physical health is still a part of that. So you know, so that needs a big a paper needs to be written about that. I think education needs to be a topic area in itself, because we know systemic racism pervades everything, and you know, our youth aren't welcome in some areas. So I think a refocus on education. There are some good programs out there. So having a paper that looks at all those different issues would be, you know, brings together what's working well, what isn't working, you know, what's the impact, and what reports have been written about it would be very illuminating. I'd like to see papers written on domestic and family violence. There's been a lot of activity in that area, so it'd be great to pull that together to see what research is happening, what policies are in place, how good are they? Are they, you know, making change in people's lives? So there's a lot of different topical areas, and that's just off the top of our heads. I'm sure if we sat down we could think of more. So the Clearinghouse has got an important role to play in the future, and there are so many different dimensions to mental health, suicide prevention and social emotional well-being. So there's many topics that we can explore, and I don't know if Fedwin might not approve of me doing this, but if people who are a part of the audience have ideas, send them into the Clearinghouse as well. You know, we mightn't think of everything, so there might be one we think, oh, this is amazing, why didn't we think of that? So do share your thoughts.
Yes, so the diversity of our world allows us to do that today. And you know, I just want to make a few comments too, to pick up on what Patty's saying. We Aboriginal people still suffer from what is called the stigma of being Aboriginal. And, you know, I'm starting to think, is this word Aboriginal really the appropriate word for us to use around Australia today? A lot of us are starting to become very traditional in our tribal approach and our clan approach to what is being Aboriginal. And I understand that in Victoria at the moment, they're discussing or having a commission into treaty, and what does it all mean in relation to our mental health and our social well-being. And each state has its own way of wanting to address these issues. And I note that in the world of Aboriginal Australians, words like First Peoples, First Nations are coming to the fore. And I think there is a strength in Aboriginal Australians today, and I use the word Aboriginal Australian in that sense, that I can say to you, I'm not happy that we continue to use the word Aboriginal, but so be it for now. So we need to discuss and introduce a forward-thinking way of producing papers that will allow our next generation to say, okay, well, they didn't quite get there, but what does all this mean about us being equals in Australia, us being the first peoples in Australia, us being recognised as having a poverty discourse to go through, which I don't believe we're going to solve in the next generation, but we need to make sure that we've got all of the ammunition for our next generation's peoples to take what we've developed forward. So, Patty, thank you for that discussion, and the Clearinghouse certainly is going to allow us to read, and those who want to do the intellectual discourse on this have to be prepared to read what is their specific area of interest and to come back to us, particularly our First Nations people. Or the First Peoples. You need to do this.
Yes.
Those of you that they're involved, you need to find the partnerships within non-Aboriginal Australia, okay, and those good people. I only heard on the radio yesterday that the population dynamic in Australia is now becoming very multicultural. And so we're not only talking about white Australians or Anglo-Saxon Australians, we are now talking about other brown-skinned populations that come into Australia and have to also exist, but we certainly need to alert them that they're not going to come in here and be stigmatised, or we're not going to be stigmatised by them and vice versa, and that we have to make sure that they're prepared to come in here with what is an equal or an equality sort of way forward.
Yes, and just absolutely, look, we do need to confront and address racism, and you know, from all those papers and program evaluations that were a part of the the growing rich treasure trove that of the Clearinghouse, the big message that comes through very loud and clear, which I'm very pleased about, is that we need, if we're going to look at Indigenous issues, Indigenous people need to be at the centre. So any group, again, I would no more, you know, think that I can write about, you know, a Vietnamese experience without a Vietnamese person very much a part of it, and to find out is that important to them. So I think that's a big message coming across loud and clear, not only in the work that we're doing, but in research and across the board, is that Aboriginal Torres Strait Islander people need to be front and centre, and proper partnerships. You know, we talk about co-design, but relationships need to be built, and that goes for us too. You know, with our work in transforming Indigenous mental health and wellbeing. We just can't just write on anything, you know, or any area without some kind of accountability. So we go out to build relationships. We talk to people and collaborate in our research activities. So it's not a big ask, and I think it is a proper way to go that that is about self-determination, respect, and that will go towards, you know, addressing some racism and those issues. People have asked too. People have asked that, you know, what do we hope to hope for the Clearinghouse to ultimately achieve? Well, I think it's achieving all the purpose that it's already doing. You know, it's about building an evidence, improving our understanding, what is helpful and useful, and I think just to quietly promote that too. I think it is a great repository of good information. That's a good culturally responsive information. So I think that you know, I'm hoping that more people will use it. Our Indigenous governance over it has been important, and I hope that it'll go on and gather more, do more activities, and become stronger over time. So that's my aspiration for the Clearinghouse, and I'm feeling pretty confident that it will achieve that. But that's probably my summing up statements, and I'll hand over to Ted to do the final sum up. Last word. You get
I've had a little note to say that the webinar is now coming to a close. So I think what we've done in the last 5 minutes is sum up for everybody what is achievable and what we think is appropriate for today. I don't have any other comments to make. I think you've done a great job, Pat, and as a colleague and a student that studied with me at uni together, and to sit down here as two elders now and to do this.
Yeah.
I think we should both be proud of ourselves, and to know that colleagues out there are better informed because of people like you and I.
Yeah.
And I believe that I can continue to make impressions in this field, in the social sciences. And, you know, I'd say to you all, may the spirits of my Noongar people bless yous to continue to work for a better quality of life in all aspects for us Indigenous, Aboriginal, First Nations, sovereigns of this country. Thank you.
Thank you, Ted. Thank you. And on that note, we're going to sign out.